Hi everyone, my name's Ella and I'm the Research and Partnerships Officer here at the TSA. I'm really excited to be joined today by Dr Alex Marsh, who is a clinical psychologist at Bristol's Children's Hospital. And he's going to be talking to us today a little bit about his ongoing trial, ACT in TSC, as well as about TAND and mental health in young people. So hi Alex, thanks for coming.
Hi Ella, thanks very much for having me.
So my first question for you is, as a clinical psychologist, can you tell us a little bit about the mental health challenges that a young person with TSC might face?
Yeah, absolutely. So I suppose for all young people, it's a really tricky time in life, isn't it? Where you're kind of finding your identity, learning a lot about yourself, kind of finding your place in the world. But for young people with TSC, I suppose their condition can bring extra challenges, and that can really depend on who they are and what their condition is, because as we know, TSC is a whole spectrum of things, isn't it? And symptoms, and so some people have very different symptoms to other people. You mentioned TAN just now, so we talk about TSC-associated neuropsychiatric disorders, which is what TAN kind of stands for. And I suppose we know that within the TSC population that there's a higher likelihood of people having other conditions like autism spectrum condition, attention difficulty, so ADHD, anxiety, challenges with sleep and behavior, which can all obviously understandably have quite a significant impact on your mental health, your well-being, your ability to engage in life. So there are lots of things that the young people that we see with TSC mention to us. One of the major themes I would point out is often feeling a sense of difference from their peers and some element of social exclusion. That's a really common theme, and I suppose given the complexity of sometimes having to miss school because of medical appointments, that sense of difference can feel like you're removed from your peers. It does really make sense why that theme does come up for our young people, and having to deal with the complications of a long-term health condition can sometimes be really challenging and add an additional layer on top of all that kind of normal stuff that we just talked about, but kind of finding yourself in the world, challenges at school, all of those, and kind of joining the workforce, all of those early experiences that are big for people in their lives.
Yeah, no, absolutely. And you are the trial coordinator of a study that's currently running. So can you tell me a bit about the work you're doing as part of the ACT in TSC trial?
Yeah, so I suppose because of these challenges that we've just talked about, we're really mindful that we need to be offering young people with TSC some support psychologically to help them cope with some of the extra challenges that come with having TSC. Uh, Acceptance and commitment therapy, or ACT or ACT, is a psychological therapy that's kind of skills focused and is shown to be really helpful for other people with long-term health conditions, and has a growing evidence base in young people as well, helping them cope with the additional challenges of life. And so we were really curious to see whether this particular approach would be helpful for young people with TSC who obviously have their own specific challenges, and so we need to be able to make sure that this is helpful for young people with TSC like it is for other health conditions. So it's important that we kind of test those things out. We think about what elements of this therapy are particularly helpful, and also whether we can do this. So one of the things that we're doing on our trial is we are offering this therapy virtually. So one of the reasons that we're doing that is because we know that young people with TSC particularly struggle sometimes to access mental health services, and sometimes the barriers are physical as well as other things. So geographical location, finding someone with expertise with TSC. And so by offering this trial virtually, we're able within Bristol to offer this to everyone within the UK, which is really important. But we need to test out to see whether that works or kind of has an impact on the way that we can deliver the therapy. And like I say, kind of testing out whether we can deliver this therapy for young people with TSC and how they're finding it and engaging with it. One of the really nice things about ACT is that its focus is on how you relate to really difficult and challenging things that show up in your life. And I suppose for people with TSC, they may have that at various different time points throughout their life. And so learning some skills to be able to cope when those difficult things do show up, and having some tools in your toolkit to be able to respond to that in a way that doesn't mean that it impacts the kind of value you feel in your life or the vitality that you get from life, is really important. And that's why we picked this particular therapy, because we thought it was a really good fit for the experiences of our young people with TSC.
Yeah, no, that's brilliant. And I mean, you talk there about kind of the difficulties in accessing support sometimes. So why is this trial so important for young people with TSC?
Well, I think that's definitely a big part of it. So, in making sure that we can demonstrate that you can feasibly deliver these types of psychological therapies to young people with TSC helps us kind of tap away at some of the potential barriers around skill sets for therapists. So one of the things that we see in the research is that when young people with TSC are referred into mental health services, one of the things that professionals sometimes say is, I'm not sure whether we have the skill sets to be able to deliver this. And so one of the things that we're looking in the trial is, well, what are the skill sets of our therapists, and thinking a little bit about how transferable those are to mental health teams. So that's really important. I suppose it's really important that we understand what young people with TSC find helpful about various psychological therapies. And I suppose we're looking particularly at AXO, which elements of this therapy are found most useful, whether young people with TSC can access this therapy, because there may be additional barriers for young people with TSC, for example, sensory differences, fatigue. We know that there's a higher incidence of kind of cognitive difficulties, say thinking skills and memory difficulties. So there may be some adaptations that we need to make to these therapies so that young people can access them. And so it's really important that we kind of think very carefully about what those adaptations might be, what would be most helpful, so that we can ensure that they're in place and increase access to mental health services and therapies for young people with TSC.
Yeah, no, that's amazing. So what is the criteria for young people to get involved?
Yeah, so that's a really good question. So we're looking to recruit people between the ages of 11 and 25 with a diagnosis of TSC. One of the exclusion criteria is that we ask that people don't have, well, that people that come onto our trial haven't had therapy within the last 6 months, and that's because there are some benefits that go on after having therapy, and so it would be really difficult for us to unpick what's actually helping that young person, whether it was their previous therapy or this new therapy that we're delivering. And because this trial is all about making sure that what we're doing is helpful, it's difficult for us to pull that apart when young people have already had therapy, and so we unfortunately are not able to offer access at the moment for young people who've had therapy in the 6 months.
Yeah, that's great. Thanks for answering that. So can you give me a reason why young people should get involved in this?
Yeah, absolutely. So I suppose what we have heard from the young people with TSC, and there was some co-production in the development of this trial. So we consulted young people and their families about whether they thought that this trial would be a good idea. Is that actually young people feel strongly about that they need to have some offering of psychological support to go alongside their TSC. So one of the key reasons would be it's really helpful for us to grow and understand what psychological interventions are helpful for young people. And so if you're keen and eager to contribute to that understanding and discussion, I suppose that's a really helpful advantage. And we try and kind of build on the steps of people that stood before us, don't we, often? And so hopefully we can understand from those young people what's helpful, and then offer that more broadly to other young people. I suppose thinking about people that we have had through the trial at the moment, that they've given some really lovely feedback, and I hope that there is opportunity for people to get skills and things out of this trial, though obviously we are yet uncertain about how well those things are working, so we need to kind of get to the result stage before we can confirm any of that.
Yeah. And final question, I wonder if you can give us a sneak preview. How is the trial going so far?
Yeah, so we've had a few people complete their interventions now through the trial. What we're seeing, so one of the nice advantages of our trial is that you don't have to have as the kind of intervention is not set, so you can kind of be flexible about the amount of sessions you need and use. And what we've been surprised by is everyone so far has taken up all of the sessions that have been available to them. So that's a really promising sign. And we've had some really lovely feedback from both the people that have been through the trial and from their local clinicians as well. A few of the TSC consultants have emailed us and with some really nice comments. So we're hoping that that is promising, but obviously we need to look at the evidence before we can kind of move forwards and recommend this as a helpful therapy.
Definitely. Well, that was great, Alex. Thank you so much for answering all those questions and, just sharing about the trial and about the progress and how people can get involved. So if anyone has any questions for Alex, do feel free to get in touch. Yeah, thank you.